Introducing the Meibomian Gland Evaluator, or MGE, from Tier Science, an instrument to provide a standardized method to assess Meibomian gland function. In this short video, we will review the concept of a functional gland, how to safely and effectively use the MGE, and device labeling. The Meibomian Gland Evaluator is a handheld instrument used by a physician to evaluate Meibomian gland secretions in adult patients during a routine eye examination. MGE labeling information is available at the end of this video and is also provided in the Meibomian Gland Evaluator package insert. If you have any questions, please contact your local representative. A Meibomian gland is considered functional when it releases liquid secretion during the natural blinking process. The MGE simulates the approximate force of a deliberate blink over the glands. This amount of force is used to assess Meibomian gland function at the time of the measurement. Prior to use of the MGE, wash your hands and disinfect the MGE with 70 to 90% concentration isopropyl alcohol. Check for any rough surfaces prior to initial use of the MGE that may come in contact with the patient's eyelid. At the slit lamp, use 10 times to 16 times magnification. Locate the lower eyelid and instruct the patient to look up and away. Place the MGE onto the skin immediately below the lash line of the lower eyelid in the temporal area. Once full contact is achieved between the MGE contact surface and the outer surface of the lower eyelid, rotate the shaft of the MGE downward approximately 15 to 45 degrees. Depress the shaft midway, approximately 3 millimeters. Adjust the position of the MGE to roll the lower eyelid margin slightly outward for a clear view of the Meibomian gland orifices. To facilitate observation of the gland secretions, gently wipe the eyelid margin with a cotton swab immediately after applying pressure and while holding the instrument in position and maintaining pressure. Hold the instrument in place over the Meibomian glands for approximately 10 to 15 seconds. Assess the secretion characteristics of 5 consecutive glands in the center of the MGE. The secretion grading scale provided by Tier Science can be used to quantify your observations for each of the 5 glands. The pressure applied with the MGE is gentle pressure, and thus the types of secretions that you will see are most likely clear or cloudy, or you may see no secretion at all. Occasionally, you may observe more solid or inspissated secretion, but this observation is relatively rare. Repeat the assessment for the central and nasal regions of the eyelid. Record the grades for a total of 15 glands on the patient's chart. Calculate the total Meibomian gland secretion score by adding the grades for the 15 glands assessed. Record this score on the patient's chart. The total score can range from 0, where there are no functional glands, to a maximum of 45, where all 15 glands evaluated release clear oil. Repeat this process for the opposite eye and document your findings. As an alternative to scoring the secretion quality, you may count the number of functional Meibomian glands, those releasing any liquid secretion. Using this method, you may count as few as 0 or as many as 15 functional glands using the MGE.
Once you've used the MGE several times, you may observe that the number of functional glands in the temporal region of the eyelid is frequently lower than that observed in the central and nasal regions. While we don't fully understand the reasons for this finding, it's actually quite common. When treating a patient with lipoflow, the MGE is the recommended method for both assessing gland function pre- and post-treatment. The MGE provides a valid metric to assess lipoflow treatment outcomes.
The following is important labeling information for the MGE. This information is also provided in the Meibomian Gland Evaluator package insert. If you have any questions, please contact your local representative. This information will help you to begin using the Meibomian Gland Evaluator. As always, we are here to help. If you have questions or need assistance, please contact your local representative.